Okay, I think we're going to go ahead and get going here. It's 3:30, at least on the eastern coast. It's 3:30, so we'll go ahead and get going. I'd like to welcome everybody. Thank you so much for being here. My name is Joe Glover. I'm president of the ADA this year, and glad that you're here to join us for really what we hope is the first of many ADA town hall forums. We're very excited about these and think these are going to be very beneficial to our membership. We're happy to have those that are on the ADA board with us, but also happy to have all of our other athletic administrators, ADs from across the country in the NAI, and hopefully some assistant athletic directors and associate athletic directors as well. Happy to have you here as well to join us for this topic. I know anytime you talk about COVID and town hall, you can certainly bet that there will be no short discussion. So we're happy to have you here and know that this will be a valuable professional development session for you. Before I get started, I do want to just kind of remind everyone that everyone in the NAI is a member of the NAI ADA this year, as far as the NACDA dues paying membership part goes. So we hope that you'll enjoy all the benefits that you get from the NAI ADA this year, and hope that you'll be able to sign up and join next year and pay the membership fee that we have. It really helps us as an association. It helps us continue to grow and helps the NAI ADA continue to do the things that we need to do to help represent all of you here in this association. So with that, I'm going to go ahead and introduce one of our sponsors. Bob Sweeney's with us today from the United States, the U.S. Council for Athletes Health. And Bob, I'm going to turn it over to you. And I just want to say thank you so much from the NAI and from the NAI Athletic Directors Association for all that you do to support us and to support our mission. And we're going to welcome you and thank you again for joining us today.
Thanks, I appreciate it, and I appreciate the opportunity to speak to all of you. What I thought I'd do is just kind of give you all a little bit of a background about the U.S. Council for Athletes Health, and also talk to you about some things that we've been working on with some of our partner institutions and some of our partner conferences since the beginning of COVID. We are a group based out of Columbus, Ohio, of sports medicine professionals, athletic trainers, team physicians, and athletics department employees and administrators that have come together really to help institutions and organizations create a culture of compliance around student athlete health and safety. So we really want to help organizations and schools, take care of their athletes based on the resources that they have, and that's been our mission. Since about April or May, it seems like our mission's been, like a lot of you, COVID and return from COVID. So we've really kicked into high gear some of our consulting and education around COVID. And what I thought I'd do is just tell you some things that we've been working on, and just some anecdotal things that we've been seeing to hopefully kick off the conversation here. Again, this is by no means completely comprehensive, but definitely some things that seem to be common themes, as we're moving forward. So as been noted, we are the official athletics health and safety partner of the NAIA, and we've been consulting with NAIA leadership, as asked, as they were in the decision-making process on COVID, response and restart. We've also been working with conferences, across all really levels of athletics, NAIA, NJCAA, NCAA, at the conference and individual institution level, on policy and procedure development and implementation around COVID, return to campus and return to sport. We actually developed some checklists that help schools, when they were coming back to campus, on how to look at their facilities and start the social distancing piece and all of that. And then very recently, we've come up with some return to sport, sport-specific checklists, things to consider if you're going to host a practice or a contest in a certain sport, in this new unfortunate normal that we're finding ourselves in. We've also developed some online e-learning modules in our platform Athletics Health Space that provide COVID education for student athletes, coaches, and staff. And within Athletics Health Space also we have a daily screening app. So something that schools can use either daily for student athletes, coaches, anybody that's coming to a practice, and also for event. We definitely got some concern from some of our partners that officials and people that weren't normally on their campuses but were coming kind of into their bubble, for whatever that, for whatever type of bubble they've created, coming into their safe space. They wanted to be sure that those people were screened, and were not coming if they were symptomatic. So we helped develop an app for that. We've also done some webinar education for student athletes, coaches, staff, and parents. And really recently, it seems like our focus has turned to testing. I think with the NBA going into the bubble and testing every day, some of the mandates that came out from the NCAA that really put Division II and Division III institutions, and really now we're getting questions from NAIA and NJCAA about testing and what the best way to test is, what's available, what the resources will allow, and really what are some things that institutions can do in the absence of being able to test to help mitigate some of the risk around COVID. So those are the things that we've been working on with some of our partners. Shifting gears to what we're seeing, I would say for the most part, especially as student athletes were coming back to campus, we were definitely seeing, and I think this continues, that we were seeing that when the student athletes were in their athletic facilities, it seemed like the staff, the coaches, and the student athletes were all doing a great job. Mask versus no mask, social distancing, all the sanitization procedures, all of those things were going great. I say this as a father of two college-age daughters. It seemed like all hell broke loose when people went back to the dorms or went back on campus. So we're definitely hoping that education would be the key to that, and creating a culture of accountability to themselves and to each other. Not only when you're with your teammates, at the facility or at the gym, but also when you're back on campus and maybe you're mixing in with the general student body. So we're definitely seeing that on campuses, that as students were returning, you were seeing spikes, and you were definitely seeing spikes in athletic department personnel and student athletes as well. So that's one thing that we saw. The other thing is that it seems that procedures and additional COVID duties are becoming somewhat overwhelming to staff, especially medical staff. And again, these are all people, yourselves included, that have other duties in a normal year, and you're adding all of the COVID piece onto it. And so that can be overwhelming. And again, the hope is that by having good policies and procedures in place, and maybe some tools to help ease the burden of that, it will help. Definitely the daily screening. I think you're seeing a lot of schools and a lot of workplaces and definitely a lot of athletic organizations doing a daily screening that's either app-based or web-based. It allows the person to take some responsibility and really take a moment to think, okay, how am I really feeling today? Do I have symptoms? And they answer those questions. Temperature screening is important, but we feel like probably the daily symptom, just taking an accountability of how you're feeling each day when you get up and get out of bed is probably the most helpful thing. And it helps, I'm an athletic trainer by trade, and I can definitely tell you there were times when we would allow kids to practice when they were sick. Our kind of rule of thumb back, prior to COVID was if they weren't running a temperature and we didn't think they were very contagious, that we would let them practice as tolerated. That has definitely changed, and that will probably be with us for a while. That really somebody that's symptomatic, until they are deemed to be COVID negative, probably shouldn't be practicing, and definitely should not be around their teammates. So that's kind of definitely changed the landscape from that. And then really just schools right now, organizations right now are struggling with what to do about testing. Some schools are lucky in that their school is testing the general student body, so their athletes can get mixed in with that and they can get some information. But when you're trying to compare yourself to groups that are testing every day or planning to test every day, that can be difficult. And also waiting on results and things like that can be frustrating. So, the testing piece, I think, still needs to work itself out. I think there's a lot of things in play coming down the pike with some rapid testing at a much more affordable price that will be helpful to institutions. The other thing is, and we're seeing this at the conference level, is really regional differences within the same conference are really making it difficult to have blanket policies and blanket decisions made when it comes to COVID. what works in Missouri might not work in Kansas, and so forth. So that's really been a challenge for some of our conference partners. And finally, really just that in absence of testing and in absence of having a lot of resources, you really have to rely on communication, education, and solid policy and procedure development to help just create this campus culture and athletic department culture of safety around COVID-19. There's still so much more that we don't know. There's still so many things you think you've got it covered. I think even in the pro leagues, you're seeing they think they probably have it covered, and then an outbreak pops up, and those things are probably most likely going to happen. But how you respond to it is going to be the big piece of all this. So with that, I'll stop talking because I know I've gone too long, but I definitely, appreciate this opportunity and I'm happy to stay on the call and answer any questions as can or participate in the conversation. So thank you very much.
Bob, thank you so much. We really appreciate everything that you guys are doing and that great information to kick off the conversation. And we'd love for you to stay on the call and help us continue with the dialogue. I'm going to turn it over to our moderator. It's going to get things going here, but I do want to recognize kind of our board of directors here. First Vice President Ashley Wallachild, Second Vice President Drew Watson, Third Vice President Jason Horn, and our past president Kiki Baker Barnes from Dillard. They've done a tremendous job of helping organize all of this throughout the year, and I just want to congratulate them and thank them for all their work on behalf of the Athletic Directors Association. They do a lot of work for our group, and I depend on them greatly. They make me look good, it takes a lot of work. So with that, I'm going to hand things over to our moderator, our Second Vice President Drew Watson, Athletic Director at Southeastern University. He is going to lead us through this conversation today on COVID, and you've got all the answers, Drew, right? You're going to tell us how to make things work.
I can assure you I don't. That's why I have a panel here to give all the answers. Joe, I just wanted to throw that thanks right back at you. I don't think there's ever been a more challenging time to be the president of the ADA. So I really appreciate the work you've put in. It's been, I know it's been some heavy lifting. So I think I speak on behalf of everyone. We appreciate what you've done in that regard. So thank you. Well, obviously COVID is what we're talking about. I was meeting with a former AD in Miami a few weeks ago, and I said, hey, you picked the right time to move on and do some things that she wanted to do, because I would say this is the most challenging time in my career, as we're dealing with not only COVID, but all the unrest in the country and the racism and all those things that are really important issues. So today we're talking about COVID, and we have a panel of distinguished guests. We have Lucas Morgan, Jeff Hamilton, and DJ Pulley here. And I'm going to ask each one of them to introduce themselves. Tell us if you're playing this fall, how many sports you got going, and then in general, how your campus is doing with COVID. We'll start with DJ.
Yeah, my name is DJ Pulley. I'm the athletic director at William Carey University. We actually have got cross country and golf have been playing. We started, had some soccer scrimmages and a volleyball game this weekend, and we're getting ready for basketball season. And for about 4 weeks, I felt like we were doing pretty good. And then last week happened, and we had a little bit of a hiccup we had to work through, but we're getting there and learning every day.
Thanks, DJ. Jeff?
Yes, I'm Jeff Hamilton, athletic director at Shawnee State. We are in Southern Ohio, and right now we have both of our cross-country teams are running. Our golf teams are participating. Both soccer teams have played a couple of games. We've had some softball scrimmages, and our tennis teams are playing, and we're getting ready to start basketball practices. And so we've been cautiously moving forward as much as we could. We have had some hiccups along the way with teams in quarantine, but I think that's pretty normal throughout the country right now.
Thanks, Jeff. Lucas?
Hey, everybody. Lucas Morgan from LSU Shreveport. Kind of echo a lot of what the other guys have said. We are one of the two schools within our conference that are playing right now. I know there's some other schools that are considering playing some of their fall sports but haven't started yet. We are playing soccer. We've played one game. We've got another one scheduled this week. Unfortunately, we have postponed a couple games. ran into some positive issues a couple weeks ago, ended up having some of our student athletes have to go into quarantine, so ended up having to postpone. Felt like we had a pretty good plan going into this. Made it 3 or 4 weeks without having any positive tests, had a few student athletes go into isolation. But it was kind of like a punch in the gut here within the last week when the positive test hit and we had to shut a few things down.
Okay, thank you, Lucas. All right, as you all know, there's a lot of different angles we can take to this, but what we've decided to do is focus a little bit on protocols and how those protocols have worked out. A little bit later in the hour, we're going to turn to the effects on our student athletes and some of the things that have been are happening there. So panelists, talk to us about your protocols. I think there's a difference when you're right now protocols in July, and then when everybody gets back. So talk to us about your protocols and then how those protocols worked out as real life has unfolded. Jeff, I'll go with you first.
So I thought as we made our way through the summer, we did a very good job of putting together protocols that mitigated risk, that put teams in bubbles, kept people separated and had a good idea of, we're screening, we're taking temperature checks daily, we're turning those in. So we've spent a lot of time and energy as administration, and my coaching staff on the mitigation part of it. I think where we dropped the ball a little bit was post-positive tests, that we weren't sure on, okay, if a student tests positive, what's the next step? Who's going to do the contact tracing, and how are we going to isolate the whole team? Are we going to try to just isolate parts of the team? So I think a lot of our energy was spent on things we needed, which was stop the spread, but we could have been a lot more proactive once that positive hits, we're going to follow A, B, and C to the T and simplify things.
Good. Thanks, Jeff. Lucas.
Well, I felt like one of the things that our campus really did well as we prepared for this was we created a pandemic action team on our campus. And it was made of several individuals from several different areas of campus, but we also used the LSU Health System, which was here in Shreveport, to work with them to kind of get a doctor's perspective, a healthcare perspective, which I really felt like was beneficial to us, especially as administrators and people working within academics that really didn't fully understand or grasp what the pandemic was maybe all about. They created a couple different things on campus that was what I felt like was pretty successful. We do have a screening that everybody comes onto campus has to go through. So they've set it up in a couple different buildings. They've also got it a couple drive-throughs in the parking lots where they ask you, have you been exposed to anybody? Do you have any symptoms? And then they take your temperature, and as long as you're below the 100.4, you get a sticker and you're admitted onto campus. So I felt like that was kind of a good start to get things going. They also did the social distancing in the classrooms that probably most of us are doing. But I'm kind of with Jeff is I think we prepared for how do we stop the spread, but once we actually had it, then what did we do? And what they've really felt like we've done well as a group within the athletic department is really relied on building that trust between athletic administrators and athletic trainer. And I've got to give a shout out to my trainer as well, because it felt like he went from being a trainer to a COVID tracer and a COVID specialist. And I think that's one of the things that I felt the most, guilty about with him is that he's spent a lot of hours doing the tracing. He's the one that our student athletes reach out to when they have symptoms. He's the one that the campus has kind of worked through in regards to the social distancing and the isolation that takes place. So it's taken a little bit away from his kind of day-to-day job. But what I felt like has kind of been really positive between all of that is that it's built a trust between us and the different parts of campus. Because I think that a lot of people at first thought that athletics was going to abuse the system. We're going to try to skate past isolating our student athletes because the only thing that was important to us was playing games. And I think as we've gone these last 3 or 4 weeks, I think it's built that trust and allowed them to realize that we care as much about the health and safety of our student athletes as anybody else on this campus does. And if there are situations that arise, we're going to be the first ones to isolate and quarantine those student athletes and notify the rest of the campus so they can do that tracing. So that's kind of some of the things that has happened really in the first few weeks with us.
Thanks, Lucas. DJ?
You know, and to kind of echo what Lucas said right there towards the end, I think in our administration, especially with our faculty, they've actually, after the first week or so, they're honestly are a little more comfortable around the athletes because we are so diligent with our screening every day, temperature checks, things like that. A lot of our teams do practice early in the morning before classes, so you're actually kind of I'd say weeding them out, but really. Our biggest thing that changed for us was in the summer. I think it was around June or so. Hattiesburg Clinic here in town had set up a COVID clinic, and it's actually, of all things, it's manned by sports medicine doctors because they were not practicing. They were not doing very many knee surgeries. And so there's a Dr. Jessica Tullis, who's actually one of our alums. She graduated from our med school. Was more than gracious with her time, and I was able to set up Zoom calls with her and our coaching staff to where they could ask their questions. Because at first I think like your coaches were trying to take it to the edge of the rule on how you could find the kids back to play and all that. And I just remember the first thing she said, guys, it's not a matter of if, but when you have an outbreak on your campus and when your team has to cancel games and when you don't practice for 2 weeks, just get ready for it because it's going to happen. And it opened their eyes up, and then it was almost, and I liked the idea because she was good about shooting down some of their crazy harebrained ideas they were having. But she also helped us, she's learned a lot from us because we've implemented we keep a daily practice log. A coach has to detail what they do before they go out there. When we do have the positive case that comes back in that 72-hour contact tracing, we can kind of go back and see, hey, what hitting group were they in? What position were they in? We were able to break it down and really refrain from shutting the team down for the most part, except for when the situation dictated. But then, also you get state and local health guidelines, and in Mississippi, it's only 3 cases in a group. Any group can shut you down, and so that's where we kind of get with our team shutdowns and stuff. But I know it's evolving. I think the biggest hurdle right now is that we're in Hattiesburg. We have Southern Miss. We have a lot of our student athletes live with students who go to USM. They're not athletes; they're just regular students. And I kind of call it, we're like collateral damage because they're not having to be held to the same. They're not being held accountable because they're online and they're going out. And, we had a situation last week, one of our teams, the roommate didn't tell us that she had lost taste and smell for 5 days. And then lo and behold, she goes out to dinner with some of our other team members. And next thing you know, they're shut down, 7 or 8 cases out of that one group. And I don't think we did anything wrong except go eat dinner with someone who was a friend of a roommate, And that's been like all our situations have kind of collateral damage of someone else, being maybe a little reckless, a little careless. And then the other situations actually, coming from family members when they go home on the weekends. But you're learning, you're evolving, but I think there's a ton of unanswered questions moving forward, as far as with certain sports, especially in basketball, and where we're going to go from there. So that's kind of what we're getting ready for.
Thank you. I'm gonna touch on something all 3 of you mentioned, but then maybe address directly, is the relationship between your local health agency, health department, and your university. Have there been challenges in that relationship? How has the relationship worked between local health officials and either your department or your university? We'll start with Lucas.
Actually, it's really been pretty productive for us and in a really good relationship that we've built. Now, it also helps that one of the systems that we're working with is in the LSU system with us. But a big challenge that I think we had when we first started was testing and how we were going to pay for testing. Our chancellor was very sensitive to the situation and wanted to make sure that athletes didn't spread the disease on campus, and wanted for us to test before and after every game. At that time, playing 5 soccer games on each side with 30 members of each team, you're looking at $3,000 per test or $15,000 even to play a few soccer games in the fall. And I think that's one of the biggest challenges that we were kind of facing as we went forward. So as we presented this to our local health organizations, they did offer us free testing. So we have free testing now for all of our student athletes. It's about a 24 to 48 hour turnaround, which has been a huge benefit for us. We're testing before and after each game. And then we've also got a testing site on campus that originally was built for our faculty and staff, but they allowed us also to send our student athletes there as well, from a free testing standpoint. So you look at that and you say, okay, is that a competitive advantage one way or the other? And I actually thought, does it put us in a position where we maybe are at a disadvantage because the universities and the colleges that aren't testing may be playing student athletes that are positive that otherwise they wouldn't have known about, and we are uncovering some of those positive tests and ended up holding people out because of that. But the relationship has been good and actually has given us the opportunity to maybe mitigate the risk a little bit more.
DJ.
You know, from the health department standpoint, I know the other day we had to report the cases. Honestly, we're like, thanks for calling, and they were really quick to, I guess we did our part. But like I said, with our COVID clinic in town, though, that's been, like I said, a game changer as far as we need. Like, so for us to get a test and testing done, it's quick. Now the drawback is that our university did take a position where COVID is a general health issue, and so it's the student's responsibility ultimately. So that it is an out-of-pocket cost for them. Which luckily most of them have insurance, so it is when they're symptomatic and stuff like that. But the clinic has been good about working out. Hey, if you come over there, you can put on payment plans and things like that. Because we wanted to test, but Mississippi was just a little bit different, I guess, with the way they distribute their CARES funding, and the clinics around us have ran out of funding from that standpoint. So that is a little bit of an issue. I think there's one, like every other week, there's a free option in town, but it takes a little longer to get back. But the Hattiesburg Clinic's been really good with us. It's first when our athletes arrived, we chose to do antibody testing because we felt like at that moment of trying to find out if you were active or not. Yes, it's important, but we antibody tested to see if you've had COVID, so we could do the myocarditis screening. Going through that, we had a list of maybe a dozen kids who said they had COVID over the summer. But then out of those two testings, we identified like 35 more who had it and never knew they had it with the antibody testing. The only thing our doctors wish we'd have done a third round because it did kind of go up after they've been in the population a week to see where it was growing. But they were good. They set the EKGs up, and a couple of them had to go on to the echocardiogram. But luckily everybody was good and we were able to clear. But we're probably going to do another round of that type of testing after the Christmas break when everybody's been home and things like that, just to kind of see the asymptomatic kids and where you're at.
Thanks, Jeff.
Yeah, that's a great observation there of having the antibody test, and we haven't had that opportunity at Shawnee. One of the challenges we've had is we have a health clinic that's on campus that has done testing for us, and they've done that free of charge, which is super helpful. But then we also have a university health team, and then we also have the local health department. So we really have three entities that all have a different role in testing, contact tracing, and quarantining, and they haven't always been on the same page. And so that's probably been our biggest challenge.
Forgot my earphones.
Is trying to sort out if a student tests positive, who's contacting them, and then the information's not always coming through those different entities to the athletic department or our athletic trainer, but that information's going through the athlete, and then we're getting information secondhand, and one person's telling them they're in quarantine for 14 days, one's telling them they're in quarantine for 10 days. So it's been the communication with those three entities has been a little bit of a challenge for us, and the local health department has pretty much deferred to what Shawnee State wants to do. So that's can be good and can be bad. They haven't provided a whole lot of guidance or leadership in issues, but have given us the opportunity to make decisions that we think are in the best situation for our athletes.
Thanks, Jeff. Joe Glover, you had a question?
Yeah, I had a quick question for you guys. We've had a couple student athletes have done the right thing and they've reported symptoms, and we've sent them to a doctor and have got tested. But I've had my first case where I've had a student hide their symptoms, or at least not be forthcoming with symptoms. And I'm just curious if you guys have A, had that happen, and B, if you have had it happen, what are some of the things you're doing to try to address that?
Well, Joe, that's one of the things that we've been concerned about kind of from day one as well, is how many of them are going to be forthcoming. And once they find out that, because on our campus, once somebody tells us that they have symptoms, we immediately put them in isolation and we send them to go get tested. So 24 to 48 hours, they're sitting out. Our biggest concern, I think, at this point is once they realize that this is what's going to happen, how many of them are going to start hiding those symptoms? How many of them are going to feel like, oh, it's just seasonal allergies and I don't need to report those? I can say that at this point, I don't feel like we've had any. I've talked to our coaches about it. They have said that they don't think anybody's hiding symptoms, that they've been pretty forthcoming. We've probably put, in the last month, 20 to 30 in isolation just simply because they've told us that they've got symptoms until they get their test back.
Yeah, I had a situation last week, and it was kind of, I think our kids are being honest and truthful, and because we've tried to explain it to them how important it is to, educate, and almost educate daily about how important it is. But it was funny last week, though, on one of the teams, a kid showed up, and I guess he was coughing and snotting and hacking and everything else. And one of his seniors said, "What's wrong with you?" He goes, "Well, my throat's a little scratchy. It's just allergy." He says, "No, you need to leave." "What'd you put on your question?" "Well, I checked nose. It's just, no, you need to go see the trainer." That's not the way to handle it, but I think there's a little bit of there maybe a peer-to-peer accountability a little bit because, we've tried to tell them, I don't want to say we get, because in some sports it is a little bit of a false hope to say, hey, look, if you're honest with us, we can try to mitigate the damage and maybe we can continue on. Obviously, in the back of your mind, you're not, but right now I think they feel like there's a hope there in the case. And, hey, just let me be honest and let the trainers do their job, let the doctors do their job. We'll see if we can move forward. But like I said, we only played a handful of events, so I don't know how it's going to be. The big thing's been if you're on the road and you're All-Americans not feeling well, where in the past they've always played with the flu. What are you going to, how are you going to handle that? How's that going to affect the rest of the team? And, we're not there yet. We don't know what's going to happen yet. So,
Ashley, go ahead.
I've just got a question. Who's got some contacts to, affordable testing? Unfortunately, unlike Lucas, my president we don't have a unlimited dollar budget to test, and that's been our biggest, roadblock, because everything we hear is, you've got to be testing because the surveillance is the most important part, and we haven't been able to do as much of that as we like. We are screening daily. I haven't had any issues with our kids not reporting symptoms, thankfully. We've involved our COVID response team at the university to get involved, but not just for our campus, but even community-wide, affordable testing just seems to be hard to come by.
yeah, we haven't had. I'm in the same boat, and I think it's a state-to-state thing too, because in Mississippi is so much different. I know last week though, when I was talking to the clinic, they were saying they're hoping that if this next funding bill goes through Congress, there's another $1 trillion bill, that there'll be some more funds available for testing. They can offer free testing again, like they were doing during the summer. Because in May, June, July, you didn't have to go pay to get a test done, no matter what, expose your symptoms, whatever. And so hopefully that's what we're hoping for. Like I said, right now it is the cost to our student athletes. It's following their primary insurance. It's cost to all of us, but it is frustrating.
We'll move on to the next question. Thank you for the input, Ashley and Joe. I'll go on to kind of I think it's probably different on every campus. How does your contact tracing work? Who does it? And has it been an issue as we've lived life here into October? We'll start with Jeff.
So our health team, the Shawnee State Health Team, does the contact tracing. So the local health department has kind of passed any Shawnee student that would test positive. Our health team takes over the contact tracing. And it's been okay. There's been some positives with it. But we've also had some issues where we had one false positive, and that athlete was living with his parents. So his parents sent him to get tested the day after at the local hospital that wasn't on campus, and he tested negative. So then we went through some back and forth on, okay, he tested positive on Thursday, negative on Friday. How are we going to handle the contact tracing there? But for the most part, our coaches have really bought into communicating with their student athletes and recognizing the importance of minimizing your bubbles. And so your whole team's not shut down. And that's really helped the contact tracing is putting them in groups of 2 or 3 so that once you start that contact tracing procedure, we almost know ahead of time, these are the people that are going to be quarantined. And everybody's bought into doing that. One of the things that's been super helpful is our cafeteria has been delivering food to quarantine students, whether they're on the meal plan or off the meal plan. And so that's been our relationship with our cafeteria has been an important part of making quarantine feasible for our athletes so that they're not trying to get food delivered from here, there, and people going to the grocery store. So the contact tracing and quarantine is going pretty well.
Good. DJ?
Yeah, I mean, like I said, kind of like what Jeff said, the coaches have bought in, with their, how they prepare before they go to practice. But usually, when we'll get a survey up, and so if we send them to get tested, then the athletic trainer takes it from there, making phone calls, contacts. Just kind of a little worried. I got one that's really, really good at it, but she's expecting her first child any day now. So hopefully they'll let her still contact trace while she's at home with the baby. But it's honestly, it's been smooth. The kids have been very forthcoming about who they've been around. We've actually, sometimes we had to pose a question to the group. If you think you've been around someone, in close contact, let us know. It's kind of a little bit of a gray area from, I guess, some HIPAA stuff, but we've been able to kind of work our way through it a little bit with the help of our general counsel. But it's not been too bad right now. Still, we know like I said, we're getting closer with certain sports. We haven't really had to contract like a soccer game yet or a basketball game. Our main ones have been baseball, softball. Those are kind of honestly a little bit easier to contact trace. And we actually were able to identify where the breakdown was, why we had to, isolate more than we should have. But as we get into certain sports, we're kind of just, I guess, waiting to see how it's going to work.
Lucas?
So for us, it's kind of 2 different scenarios. So we've had the issue in the classroom where a student athlete was sitting next to a regular student who tested positive in the classroom. In that case, our Dean of Students and our pandemic action team has done most of the contact tracing for that. They've tried to space out as much as they can, but what they've chosen to do is that if somebody does report a positive test in class, anybody sitting around that individual, and they've done assigned seating in all the classes, so anybody within a chair or 2 of that individual is also put into quarantine because of that. That's been a bit of a sticking point with our coaches, and it's something that we're continuing to try to address on our campus. So that's the one side of it. The other side of it is basically our athletic trainer handles it. So the 2 positive cases, we had a men's soccer player and a women's soccer player from this past week. And our athletic trainer is the one who kind of handled all the contact tracing for that. He talked to that individual. He talked to the individuals that they said that they were in close contact with. It was after one of our games this previous week. So he traced it back to who'd you sit next to on the bus? Who did you eat with when you guys had your pregame meal? When you were on the bench, who were you close to on the bench? And it ended up being 2 assistant coaches and 6 student athletes that were all within that kind of contact tracing area that we ended up having to put into quarantine because of that. There weren't any individuals that actually played in the game that we put into quarantine. It was just based on those scenarios that we talked about. But I think that's probably a challenge, is that each institution is handling that a little bit differently. I've heard from other athletic directors that if they do have a positive on their team, it's not just the individuals like we talked about in our situation, but they're quarantining the entire team because they were all at practice together or weights together. So that's kind of something that's continued to be discussed.
You know, and one more thing, Drew. Something else that I guess, and I hope it works, but it's something we've done is like if you're roommates in the dorm, you're going to be roommates on the road. You're going to sit beside each other on the bus. You're in the same weight group. We call them COVID buddies. That way, if you're trying to manage the damage in certain situations, you know, like our bus companies reduce the capacity on the bus. We can't have it 26 on the charter. So you can try to social distance. You're going to have to wear a mask. And there's just things we're doing to try to make contact tracing easier. Like I said, but it all goes back to documentation.
Good. Thank you, DJ. We have a comment here from Courtney Thompson from Mount Mary. She says, we found daily antigen testing is only $5 per test. This way, they only have to spend the money for PCR tests if the antigen testing comes back positive. It's much more affordable than regular PCR testing. That's actually, I'll speak to that too. That's something that Southeastern has done as well. We will antigen test them, and if they come up with an IgM marker, we will send them for PCR and isolate them. I'm going to throw you guys a curveball. You don't know this question is coming, but it's probably going to be one of the most helpful. Is what has been your biggest or most impactful insight since COVID started? So I'll just let whoever's ready to answer that can go first.
COVID's in control and you're not. I mean, it really is. I mean, I know how everybody had to feel in the summer. It changed every day. I mean, I looked on there today before I came on. I had 48 different versions of the try to reopen plan because I was just saving it up there. I got kind of curious at one point. But COVID's in control. It's a virus. You know, I have my own personal opinions about it, but it's like I tell my coaches, we have to play the hand we're dealt, regardless of that. So, you know, quit feeling a certain way about it. You know, but that's your question. That's my first thought.
Okay.
I think mine is
go ahead, Lucas. No, Lucas, you go ahead.
I think I was going to say is you're never as prepared as you think you are. And I think we all spent a lot of time this summer being prepared or thinking that we were prepared until it actually came. And then we realized that all those hours, all that time, all those conversations, that we thought that we were ready, that we really weren't.
And I just agree with both DJ and Lucas. I mean, the number one thing is that the virus is its own living beast, and we have to be flexible. There's a lot of things that we wanted to put in place, or we did put in place in July, that aren't applicable in October. So just maintaining that flexibility and having clear and open lines of communication are critical.
And I think it's important to remain positive too, because it's easy, especially with what's going on, to be negative. And as positive as I felt like our athletic department was, once we lost control, I felt all of our coaches start to get a little more negative. And even things that we don't normally get upset about, a housing issue, turned into a huge deal, and it snowballed into every one of them jumping onto that. And I think since we've been back and since we've been able to play again, it has allowed us to bring a little bit more of that positivity back and a little more sense of normalcy.
Good. Thank you all. All right, we're going to turn from policy and procedure, health departments, testing. We're going to focus the last 15 minutes here on our student athletes. And so the question that you just meant, Lucas mentioned something with the coaches, and that I think points to mental health when you're getting upset about a housing situation because you're upset about a lot of other things. What mental health effects have you seen in your student athletes since getting them back on campus? And we'll start with Lucas on this one.
So probably the biggest one would be similarly to what I said about the coaches, as well as I think there were so many unknowns with our student athletes, and they were afraid that they weren't going to be able to play. They were afraid to come back. They were afraid of what to expect once they got here. And then I think once we were able to show them that you are safe, that your safety is our number one priority, I think it made them all feel a little bit better once they got here. But we've really put a major focus on giving the mental health resources to our student athletes. we've worked even closer with our counseling department on campus. We signed up for a program that's called Therapy Assistance Online, which is a program that makes resources readily available online to our student athletes. And we have seen several of them start to use that. It doesn't obviously give the data to us as athletic administrators, but we're able to see who is using and utilizing the resources, which our coaches are utilizing those as well. And that's kind of been a major focus of ours, is just making sure that we do have those tools and resources available.
Good. Jeff?
I think frustration's the easiest way to describe it. I think our athletes have been frustrated with a lot of different things. The unknown obviously is the number one, but on top of that, every process that they go through seems to be backed up a week or 2 weeks because the other resources on campus are half of them are working at home, half of them are working on campus, and everything just is slow to get done. So some of the best things we've done is our coaches have, from about the middle of July till our students got back, and even now as our county has moved up a level on the risk of having weekly Zoom meetings so that they're having an opportunity. I mean, it just gets frustrating when every time you're talking with them, you have to wear a mask, you have to stay spread out. And so the weekly Zoom meetings that our coaches are doing have been really helpful. And it gives those athletes a platform, that's not around practice or not around competition, to have open lines of dialogue. And that's spilled over into some of the race issues that are going on, and just allowing our athletes to have that voice outside of just the athletic piece of being an athlete on our campus.
DJ?
No, I think it's, and I think it's, again, and it might be just how your states are reacting to it. I know Drew, you did down there in Florida, y'all had it was a rough go in the late summer. Mississippi was the same way. The thing that I've noticed, and it's really when everybody came in, which everybody at Daly's been on point. They were really, I guess, doing their surveys, wearing their masks, really eager to make sure they're doing everything right. But in Mississippi, I think once you start seeing the cases go down dramatically, I think we're trying to encourage them not to drop your guard. And now you're kind of getting a feeling they're like, well, are we through this? Are we over it? And, you're so, no, guys, that we still got a long way to go with that. So I just worry there might be a little mental fatigue going on with the athletes. I know with the coaches, there's a big issue with that. Sorry, stinking fly flying around me. But it's that's going on. But then I think one thing that does concern me, and I know we talked about this a little bit yesterday, Drew, is I have a former player of mine who is a doctor now. He just got a medical a couple of years ago, and I talked to him probably every other week just to touch base with him, bounce off, and he's always talking about, say, hey, be mental aware of their mental health, because the number of people going on antidepressants right now is shocking. He said this is beating people up mentally more than you think, and so I keep telling the coaches, and the coaches are understanding that too. Is like, hey, it's not a normal year. In the past where don't ride kids. They say they can't come to practice. They can't come to practice. There's things that they have to adjust to. And, I've got some coaches who've been coaching for 35, 40 years. And, things are just not the same as they were. And it's just getting them adjusted. But they bought in. We're trying to make the kids as comfortable as possible. Playing games this week helped tremendously. I'm kind of eager to get the rest of the month going, just because I know it kind of made that group happy, which has helped the other sports who are just trying to prepare. But it's something. The mental health is definitely going to be the long-lasting side effects of COVID, unfortunately.
Drew, I know that you posted a lot on social media about facts over fear, and really were kind of proponent of the return to play. What are some of your thoughts that you've had related to kind of the return and the mental health of the student athletes, to kind of throw it back at you?
Appreciate the question, Lucas. I think I've seen what you three have mentioned. We have had, I would say, what COVID has done over the last 5 months has exacerbated mental health issues that were already there. And so, we're sitting on October 6th right now. We've got already 4 instances in our student athlete population where there's been never an attempt of a suicide, but a situation where we've had to have serious intervention into, and it's stuff triggers it that, it's just been, that wouldn't typically trigger it before. And so it's been a real challenge for our coaches who, more than normal, are feeling like their mental health, they've got to be counselors, they've got to be paying attention to mental health. I feel like it was getting bad before, but since COVID, it's been a lot worse. So I appreciate that question, Lucas. Now, I'll turn it from that, from mental health effects, and we've kind of been talking about generally, but how about athletically? Have you seen any difference or heard difference from the coaches in how your student athletes are responding on the field and in practice? I'll throw that out generally.
Obviously when they came back in, they were very out of shape because they haven't been able to train and things like that like they normally would. But and I think that's one of the good things from the in our case, the delay in the start. It allowed us to slowly build back up conditioning to where we want to be. You couldn't have done it in a 3-week window like we typically do. But I think there's a lot of good things. They like where they're moving. It's still got a long way to go to get back to where they were at. Because that was 6-7 months. I didn't get to do anything. That's a lot for a college athlete, especially the seniors who are already, are kind of maybe their skills are just starting to go down just a little bit. Some of them, I know some of the coaches I've heard them say they're just not. Some of the seniors are not as sharp, especially the ones who actually get the extra year with the baseball, softball. They've been talking about how they've kind of actually struggled in practices and workouts and things like that because of the layoff. It does affect them a little bit, but it's getting there.
Our athletes have been super excited to get back to practice, and I think one of the things that working out in the gym or the weight room or on the soccer field is it's an opportunity for them to have some sense of normalcy. They don't. I think in August and the last couple of weeks of August, our gym it was never packed, but there was always somebody in there because it was the only place that you could go and not have to wear a mask as if you were shooting baskets. So every time I walked through the gym, there was always 3 or 4 people in there getting some shots up. So our athletes were super excited about just getting back to some normalcy, and their endeavors gave them that opportunity.
Yeah, our return has been a little slower than what we would normally have. It's taken a little bit longer. Our coaches have been a little more patient in terms of returning to play, knowing that they've got a little bit more time to do that. Probably the biggest concern is the starting and the stopping. At any point, we've had 5, 6, 7 individuals out at practice for a couple weeks, and I know our coaches have been worried about their conditioning and their timing and everything as they return to play. So what we've done is we got approval from our pandemic action team to basically have a quarantine training group. So although those individuals are supposed to be quarantined, the ones that are that have been put into quarantine or isolation because of tracing and not because of the virus, we've allowed them to continue to train by themselves as a group so that they aren't losing that conditioning that they would have otherwise missed. I think our biggest concern, maybe moving into the spring with baseball in particular, is what happens to that pitcher that isn't able to get out and get the work in and do the throwing program that he needs to do. Once you return to play with him, how quickly is he going to be able to pitch again? And are you potentially losing him for the season if he's out several times throughout the year?
Thank you. We do have a question from Sean Tackett, who's the athletic trainer at Lyon. He's asking this question for those schools that have postponed their fall seasons to the spring, with your athletic trainers being the primary contact tracers for your athletic teams. How do you foresee them being able to do that in the spring while they're handling all of their athletic training duties as well?
That's another question on how we're going to all handle the spring, I would assume. Right now, though, in our situation, every sport's practicing. Obviously, it's not the same as games. Still, though, it's a matter of prioritizing. There's 2 trainers in my, and if needs be, I've made calls to a couple athletes here and there to do a little contact tracing to provide information. But it's definitely a team effort. It's not going to be easy. I mean, I've looked at the calendar ahead. It's going to be a brutal spring, and in more ways than one. But I think it's going to take a lot of a team effort. It's the only way we can do it.
We've also hired a couple contract trainers to help with our practices here in the fall. We've been able to use some of our CARES Act money to be able to do that. They're working partial hours, helping out with practices. We'll probably end up helping out with the games as we have more sports to start to play together in the spring. But like DJ said, really kind of a team effort, all of them working together.
Jeff, anything to add to that?
I mean, I think our athletic trainer doesn't do the contact tracing. So that, I mean, I have enough concern with just them handling what's going to happen in the spring. So I couldn't imagine trying to put the contact tracing back on that body as well. So we're fortunate to not have to deal with that in-house.
Are there any other questions? We've got about 5 minutes and we'll wrap up. Raise your hand, speak now or forever hold your peace. All right, I want to thank our panelists, Lucas, DJ, and Jeff. Question, I hear a question there? No. All right, thank you, Lucas, Jeff, and DJ. I really appreciate you being here and taking your time in both preparation and sharing your wisdom with us. Bob Sweeney from the U.S. Council for Athletes Health, we appreciate you being here, spending your time with us. Thank you all for being here, and we will catch you later. Thank you.